Assalamualaikum. My name is Wasatullah, roll number BP145011, class final year morning. Subject pharmacy practice. My topic is nitrofurantoin. Nitrofurantoin overview. Nitrofurantoin is a broad spectrum antibacterial agent active against the majority of urinary pathogens. It is used to treat a urinary tract infection, including cystitis and kidney infection. Indications: acute uncomplicated urinary tract infections, acute cystitis, and muscle relaxation long duration for surgery and incubation and prophylaxis UTI. Side effect: gastrointestinal, diarrhea, dyspepsia, abdominal pain, constipation, emesis, and in respiratory acute pulmonary hypersensitivity reaction. Hepatic hepatic reaction including hepatitis. Contraindication: nursing mothers. Nitrofurantoin has been detected in human breast milk in the trace amounts. Pediatric use: nitrofurantoin are contraindicated in infants below the age of 1 month. Safety and effectiveness in pediatric patients below the age of 12 years have not been established. Geriatric use: clinical studies of nitrofurantoin did not include enough subjects aged 65 and over to determine whether they respond differently from younger subjects. Warning: abdominal pain and weight loss and other warning signs in ulcerative colitis and Crohn's disease. Irrational use: nitrofurantoin is commonly used to treat urinary tract infections, but is not recommended in patients with an estimated kidney glomerular filtration rate below 45 ml per minute per 1.73 meters square. Brand names: there is a two low price brand and high price brand. In low price brand, Furadin, Furantine, Frontin, Furosil. Furon, and in high price brand, there is two Furadentin in Urestone. Dosage and method of administration. In adults, dose is 50 to 100 mg 4 times daily for 7 days. In long-term suppression, 50 to 100 mg once a day. Frequency 6 hours. Pediatric dose is 3 mg per kg day in 4 divided doses for 7 days. Suppressive 1 mg per kg once a day. The route of administration: these all, these all drugs are used for oral use. Case study. Case study: a 23-year-old healthy female presents to a clinic with a 2-day history of on and off dysuria, difficulty in urination, urgency, and increase the frequency of urine, and a single episode of gross hematuria. There is a no fever or back pain. Subjective: chief complaint: dysuria, urgency, and increased frequency of urine. About medical history, she has self-medicated with cranberry juice, juice and peridium 200 mg, which was left over a previous urinary tract infection. Her urine is consistently dark colored. She has had two prior UTIs in the past year, which were successfully treated each time with trimethoprim sulfamethoxazole 160 mg, 160 mg, 800 mg twice a day for 3 days. The last UTI was 4 months ago, and there is no history of plenferitis. She is sexually active. There is no history of sexually transmitted disease. Object. Object. Culture and sensitivity tests are particularly important with recurrent UTIs to exclude infection with new organisms such as Proteus mirabilis and Klebsiella pneumoniae, or the emergence of Streptococcus resistant to trimethoprim trimethoprim sulfamethoxazole. For this patient, urine sampling with a dipstick and microscopic urinalysis and culture and sensitivity should be considered as the next step. Urinalysis was positive for pyuria at 3 leukocytes HPF, a high power feed. Urine culture was sent. The information obtained so far suggests a lower tract UTI. Assessment assessment. This patient is primary of dysuria given her history of recurrent UTI and her response to trimethoprim trimetho- trimethoprim sulfamethoxazole. It is likely that she was infected with Escherichia coli in the past. Escherichia coli is the most prevalent pathogen in this scenario. And she is at risk of reinfection due to previous antibiotic therapy and sexual activity. Therefore, the first possibility for diagnosis would be uncomplicated lower tract UTI, which is characterized by symptomatic patient with bacterial colony count of more than 100 colonies per plan. Since urine culture results are pending and finding pointed to an uncomplicated lower UTI, immediate management should include an antimicrobial with activity against Escherichia coli and Staphylococcus saprophyticus, the most common UTI pathogens in women during the reproductive years. The following are the dosing options for this patient. Trimethoprim, trimethoprim sulfamethoxazole in 160 mg and 800 mg twice a daily for 3 days. Consider resistant potential. Nitrofurantoin 50 to 100 mg 4 times each day for 7 days. Or nitrofurantoin is a macrocrystal and monohydrate 100 mg twice a day for 7 days. Levofloxacin 250 mg once a day for 3 days and ciprofloxacin 250 mg twice a day for 3 days. Difference. Okay. Yeah, thank you so much.